Hi, everyone. Welcome back to the Holistic Pharmacy Podcast. I have with me today Dr. Stephanie Youngmus. She is a pharmacist and wellness advocate. So I can't wait to hear everything that entails during this interview. Welcome to the show, Dr. Stephanie.
Hi, thank you so much for having me. I appreciate it.
Awesome. All right. Well, I usually like to start with having the guests introduce themselves, where they grew up, how they became a pharmacist in the first place,
Mhm.
and what was their educational journey like.
Okay. Well, I am originally from Tennessee, so I'm a Southern girl, but I live in the Midwest. I've been living here for 2 decades now, and I was only supposed to be here 2 years, but I ended up staying, and I moved here for a fellowship after pharmacy school. But speaking of going back to pharmacy school, I went to pharmacy school at Xavier University in New Orleans, Louisiana. And after I finished school, I actually was focusing more on working in the business side of pharmacy. So while I did all the clinical things, of course, I did all of my rotations where I worked in retail, I worked in community pharmacy. I even did a managed care residency. I was one of the first to do it in my school. And then I ended up working for a pharmaceutical company as an intern. So I ended up finding that interesting and ended up deciding to doing a fellowship to see what other areas I could do in that industry. So from there, I ended up doing a fellowship, was there for a few years, and went to managed care for about 12 years. I was in managed care for a long time. And then currently I am in health outcomes and research. Pharmacy school is great. To be honest, when I first went to school, I wasn't quite sure which direction I was going to go into. And I had one of my advisors in college was like, have you ever thought about pharmacy? So from there, even before getting into pharmacy school, I worked at Eckerd. I'm not sure if you heard of Eckerd. It's in the South. Yeah, Eckerd.
Yeah, we've had it for a brief stint. It's been phased out or bought out.
Yeah, it is. I think by Rite Aid, if I'm not mistaken. But I worked there like before school, got to learn a lot about the pharmacists. And they even had a community pharmacist there that owned a pharmacy that was down the street. And they bought him out and hired him at that pharmacy because the community loved and knew him and still wanted to interact with him at that time. So that's how I learned a lot about pharmacy from that. And then I just ended up going to school, got into school, had a great time in school down in Louisiana.
Awesome. Yeah, I actually love that approach of first experiencing something to be able to know whether or not you'd want to dedicate, 6 or more years of your life studying it.
Yes.
It's a great idea.
Exactly. So I had really good mentors there that really kind of taught me about pharmacy, what they liked about it. And then when I went into school, and I actually did my pre-pharm in Tennessee, and once I got into pharmacy school at Xavier was where I was really able to explore the different types of pharmacy. Of course, we really don't talk about all the different types of pharmacists that there are. Especially first being in school, they were so focused on retail then because there was a huge shortage. So they wanted everybody to go to retail. We need you, we need you, we need you. People are getting older and we need more pharmacists. So I had to really go out of my way to kind of learn about managed care, learn about industry, learn about different other areas that pharmacists could do. And that's how I ended up doing what I'm doing today.
Yeah, and I really find that fascinating about your story. Is there any particular reason why you chose pharmacy in the first place? Did anybody in your family or your community influence you? And then why were you so passionate about exploring those outside of the community setting type of practices?
There was no one in my family that actually was a pharmacist. I knew I wanted to go into a health field because my dad is a chemist and my mom is an ultrasonographer. So my first job was working in the hospital. I was actually an assistant to the ultrasonographer and to the radiologist. I would take the film back in the day when they had film. I would take the film into the radiologist to let them read it. So I knew I wanted to be in the health field, but I just wasn't sure which area. And that's when my counselor asked me about, have I ever heard of pharmacy? And I started to research it then. So yeah, but I knew I just wanted to do something a little bit different. I did enjoy retail while I did my rotation in school. And even when I graduated, when I did my fellowship, I did retail like part-time so that I can keep up and still have that communication and interaction with the patient. So I did that for a while. And then I decided, you know what, I think I want to go I wanted to work in the office, and I just always have. So, like I said, I did that part time, and I actually worked for um, a grocery store chain in Indianapolis while I worked for in the daytime. I worked, excuse me, nighttime. When I got off, I would go to work, and that was free kids and everything. So then after a while, I just decided, you know what, I'm just going to do, it was managed care at that time, managed care pharmacy, and stuck with that.
Wow. So what were kind of like your expectations going into pharmacy school and having those
Mhm.
experiences versus you being a new grad and having, the world at your feet and all these choices of, pharmacy that you can go into. So what was expectation versus reality?
Well, expectations, I think, when you're in school and you're learning all of the drugs, I know you remember having that stack of cards where you had to learn every single drug, every single disease state, every single side effect, everything. So it was really, first, it's kind of scary when you think about they can come here with any of these drugs and I need to know it. But then you don't realize, I can look it up if I really don't know it. Or the more you work with it, you work with the same type of drugs that when the people come in, you kind of get to, you have your top 100 or your top 10 or whatever that you deal with. So I really wasn't, as far as dealing with patient contact, I was excited. But when I came to Indiana and I was working for the grocery store chain, there weren't very many people that looked like me that worked in this area. I was in a rural area in Indiana, like a suburb area of Indiana. And I looked young, I think, back then. And, and here I am. And so they were like, "Who are you? And where's Ed?" Like, seriously, they would ask me that when I would come in. Because sometimes I would float too, but I would be at one store more often than other. So they were you actually looking at me like, "Who are you? And can I please talk to the pharmacist? Why can't I have my pain medication?" Literally, they would go off on me because I was doing the right thing. I
Yeah.
was literally really, you just had it 10 days ago and you got to wait 20 more days. So that kind of was kind of a shock where people really didn't respect, and it was ageism, probably sexism, and all of that because it was young Black girl coming in here. Who are you and how can you have authority of a pharmacist? But all in all, I did have some great customers and people that I met and patients that I met, but then there were some who just didn't uh, think I had any authority to tell them what they could and could not get.
Yeah, absolutely. I mean, I also find that with doctors and other providers too,
Mm-hmm.
when you try to do your job and make a suggestion, they're like, "Who are you? How old are you?" Even
Right.
with the phone, who are you to tell me what to do? I'm aware of this and that.
Exactly. And not realizing we took pharmacology probably just a little bit longer and we're not taking anything away from you. We're not trying to take your job. We're just trying to help. And this should be a team effort. So hopefully that had a little of that has changed. And I think it has. I think that people are really respecting pharmacists a lot more and they really realize the type of value that we bring when it comes to the clinical side of pharmacy as well.
Yeah, I agree. And I think it also matters the kind of attitude that you approach both patients and providers with, and,
Mhm.
coming at it with like an open mind and also hoping that that person reciprocates rather than this air of superiority, like, "Hey,
Yes.
I know something you don't know."
You're so right.
Awesome. So how did you find yourself then cruising through and mostly being in managed care? How was your job satisfaction, career satisfaction, and all of that?
Well, working in managed care, I actually, well, my first job when I came into, after I did the fellowship, I ended up staying on with that company and I went into compliance. So I was the one who would train the sales reps on what you can and can't say, what's allowed, what's not allowed. You can't make any claims. So I was doing a lot of that type of teaching. So going into managed care, I got to really see some of um, uh, the business side as far as approvals, prior authorizations, those types of things. But it was more of a looking at either Indiana, I had either actually Indiana and Kentucky. So I would look at Indiana to see what types of issues we had as a community and how can we tailor our formula to address some of those problems. So I did like it, and it was about looking at the cost of care and making sure we were saving money here, and making sure that if we have a drug that's either generic or a drug that's on formulary, trying to show the doctors, this is the reason why we chose this on formulary. Not telling you what you have to do, but we just want to educate you on the reason why we put this on formulary. So it could be a letter campaign. It could be going to see a doctor in person, and then also just telling people about our pharmacy benefits as well. So it actually was, I mean, I was there a long time. When I say 12 years, I'm thinking I was there for a very long time. And it was a good experience. And people were very nice. And it wasn't a stressful, it's not a very stressful, high stress job to work in managed care either. We had our meetings, and I even had an option to come into the office some days if I wanted to. So, I mean, I would come in maybe 3 or 4 days out of the week for that job. Did I miss what's the second part? Oh, managed care. Yeah. So as far as managed care, I did enjoy it. And then I ended up going to an AMCP meeting and meeting an old colleague that I worked with at my first job in industry. And they were like, have you ever thought of health outcomes? And I was like, actually I had, because in my fellowship, we did rotations through each of the areas within industry, and health outcomes was one. So I did learn some about it there, but after looking into it more and realizing working in managed care, a lot of the things that I did actually was outcomes. It was economic. It was trying to see to make sure, does the drug actually does it do what it actually says it's going to do? Is it saving money? If it does cost you money, are you at least saving it on the medical side? So I kind of related to that and ended up talking to the colleague and spending a little bit more time making sure it's what I wanted to do, and end up interviewing and got that job there.
So as you were going through your career, did you find yourself noticing things that could be improved upon or optimized, or things that maybe you didn't agree with 100% and you wish that you could change?
Yeah, I think that especially in managed care, I think the good thing about the company that I worked for is that we did have an integrated formulary, which I think a lot more companies hopefully are moving that way. So our health plan is tied to the pharmacy benefit. So that way we're not trying to control the spend on pharmacy. We're trying to see how they both work together. So I do think that's the best approach to have, because you're not just trying to reduce a piece, you're not trying to reduce a piece of the pie, you're trying to reduce the entire size of the pie and the spend and everything. So that's one that I really did like about the company. And then also looking at the appeals process too. If there's a reason why a patient feels as though they should have the drug, they should be able to take the drug, there's always a way for them to be able to appeal that and be able to get that drug. Now, sometimes that can be a lengthy process, so that's probably one thing that I would change, would be able to make that process a little bit easier. But all in all, I think the company that I worked for really did try and make the right decisions for their formulary based on what it did for the medical as well.
Awesome. So tell us about your website and your platform and what you're building, and if you are doing this as you're working full time, or if your goal to transition, and how you've been building that up.
Well, about 2 years ago now, I think maybe a little bit over 2 years, I was actually downsized from the first health outcomes job that I had for a pharmaceutical company. And so at that time I was thinking, you're on social media a lot and you have this time to really think about what you want to do. So let's try and use social media to be more purposeful with it, not just look at my food, what I'm eating, which is fine, but am I teaching? If I'm showing my food, am I teaching what's in the food? What is it doing? How does it work for your body or whatever it is? So I just wanted to have, right, exactly. So I just wanted to have more purpose when I was on there. So I ended up switching my personal account to a business account. And I would do things, talk about wellness. I would talk about wellness for kids. I would talk about sugar, and then other health problems as well. But during that time, I would also have healthcare professionals that would come to me and say, how did you get your page to look like this? Because if you go back to look at what my old post looked like and how it transitioned, it was almost drastic the way my posts changed from the look of them and the aesthetics of the post. And it was really because I actually owned an embroidery store for 9 years, and I did a lot of the designs. And I really didn't think, Stephanie, you're good at this design thing. Like, I didn't even think of that as being an attribute or something that I was really good at. So I tell people all the time when they come to me and they're like, well, I'm not good at anything, or I'm just a pharmacist, which they don't realize that they're taking for granted so much information, so much knowledge that they have that people will love to hear about. So whether it's something to do with health and wellness, whether it's pharmacy, whether it's you're a great organizer, whether you can do drawings in Adobe or whatever it is, ask yourself, and then also ask people around you, what would you say? Why do you come to me? Or what would you ask me a question about? If you want to get expert advice, what would it be? And you would be surprised at what people say. So I always took for granted that I actually knew how to design things. So, and it showed on my page, and people would come to me and ask me that. So I did start trying to teach people more of that as well. But at the same time, doing my volunteer work for 20 years, I worked in health advocacy for serving the underserved population right out of school, being on boards for that. So that was also a passion that I had. So I took both of those and kind of married the two together. So a lot of the posts that I make for health advocacy, like showing either trends or showing statistics about certain disease, especially in underserved populations, were very popular and would be shared a lot because of the way they looked. Because if you have something that you want to share, you need to be able to break that thing down so the patient or whoever can understand it and make it easier for them to read, and also make it pleasing so people will want to share that information, which helps your advocacy as well.
Wow, that is so unique about the embroidery store. How did you get into that passion? And it's so interesting that some people have like the most opposite of passion, right? Like art and pharmacy, or and then they're able to marry the two. So can you talk a little bit about that?
I had to feed the other part of my brain. It was something that my husband and myself did. We were, it was embroidery and shirts. We saw a need in an area that we're in. We're both in fraternities and sororities, actually international fraternities and sororities. And there was a need that people always either wanted business shirts or something for their schools. And we looked into it and ended up finding actually a franchise, and they taught us everything to do with the embroidery and the design. And just over time, if you own something for 9 years, a lot of people think, I'm going to own a business, but I don't want to have to do anything in the business. I'm just going to hire somebody to do it. But there's times when you will actually have to make a design. You can't always send it out. So I had to learn and teach myself how to do it. But although I am a pharmacist and probably I'm analytical, but I am probably the opposite, where I do like to use that art and feed that portion as well. So it kind of gives me kind of an outlet, I guess you could say, when it comes to doing day-to-day work, because I do work full-time in health outcomes as well.
Yeah, I'm just looking at your page here and your website, and I can totally see the unique color schemes and patterns, and it matches the background that you have the back of you. So I could totally see the
that was not I didn't do that on purpose.
Yeah. So did you design your website as well?
Actually, so my sister is she does website design, and she actually I want to say encouraged, but she influenced me and inspired me to be able to do something like this. So she was actually working in broadcast, and she quit her job. She learned, well, first she learned on the job. She didn't just quit, she learned on the job, and she ended up learning how, just a second. Thank you. I'm sorry, I had a kid just come inside. They forgot I was on a very important meeting. But so she ended up leaving her job after she learned web design and started her own business, where she actually made web design. And she would tell me, Stephanie, this is a great area. You should really look into it. You should think about social media. And so she really actually inspired me. So she did my website, and but I actually Instagram and the Facebook pages and things. So she's very helpful when it comes to, hey, I need to, I have a webinar coming up, or I have a class I want to teach. Can you help me set up the back office? Can you help me set up the sales page? So she's really, really good with that. And she's about to have a baby in 2 weeks. And I'm like, can you do this before you go on maternity leave? You are an entrepreneur. Please. So I'm really trying to be respectful that, this is, even though this is my sister,
Get it in
and
before.
what did you say? Anything before?
Yeah,
I'm like, can you please
before,
just,
yeah,
can you
after.
just slide this in there? Because I actually really want to do a total redesign of my website. And I'm like, that wouldn't be fair. I'm not going to do that. So I'm like working in the back office on my website on my own to see what I can change. I'm not changing it. I'm doing it like in the background. So I won't mess anything up while she's on maternity. And I try to respect her boundaries. I pay her as my sister. And then I also don't ask and overstep either, because I know she has clients that keeps her busy and she's trying to get things wrapped up as well.
That's beautiful. Family duo. Do you have any other siblings?
Yes, I actually have another sibling. So that's my middle sister. I have a younger sister as well. And she's actually an ultrasonographer. So she took after my mom and went to ultrasound, and she's an ultrasonographer. And she does cardio. So I think she does, there's an official name for it. I can't think of it, but she does any of the cardiac patients that come in, she does their ultrasounds for that.
Nice. So I love that story about you transitioning your normal page into
Mm-hmm.
something, like you said, purposeful, something that really lights you up and you're passionate about. So it looks like your sister influenced you. Was there anything else that inspired you to do this, even though you're pretty satisfied with your job, you're working full time?
Mm-hmm.
What is the ultimate goal? I would assume it's the mission rather than the money. I don't think
Mm-hmm.
the money is the driver here, but
Mm-hmm.
ultimately, do you want this to be your primary source of income? And ultimately, what is that message that really you're passionate about sharing?
Well, I think that, the first thing you asked. Oh, you asked me a question at the beginning. I can't remember what it was.
Oh, it
You
was
said.
about, did anything in particular inspire you to start
Okay,
page?
that's it. Yes, so that's it. I think I think being downsized and sitting at home, I wanted to do something more purposeful. So I did do some of the volunteer work, as far as I got on another board for a local clinic and hospital. And then so I did share some of my advocacy things with that on my page as well. I think having that platform when people say, I don't have to have a personal brand, I don't have to have a social media account, I don't have anything I really want to push. But if you want to advocate for something, the best way to me is to be able to share that across to thousands or millions of people on social media. So when I talk about healthcare disparities, or if I talk about things that help, health inequities, there are a lot more people that may not be aware of some of the things that I discuss, that would otherwise not have known about it. So that was another way for me to be able to share that as well. As far as when it comes to where I want this to go, I do like corporate America, to be honest, I do. But of course, who wouldn't mind having their own, their business, their own way that they can leave their mark, I think would be, a great way to say it. So if people ask, well, what did Stephanie do while she was here? It would be to try and serve the underserved and be that voice and help them have their own voice, rather not be their voice, but help them actually have their own voice as well. So it would be nice to have that. I'm employed now, so in case my employer's watching this, I do like it. But the good thing is that my immediate person that I report to, they're very supportive, and they even have their own thing as far as what they do as well. So I think it's an outlet, and it's also a way to advocate, and then if I want to, it can turn into a full-time business, I believe, as well.
So the message that you have is to improve patient care and to serve the underserved.
Mm-hmm.
Do you have, like a plan of action, or how that could be implemented in today's, setup healthcare system? And did you personally come across this and see this in practice, or with yourself or with your family going through the healthcare system? Like, how did this, become such an important topic and personal topic for you?
Well, I think first, coming out of school, the school that I went to was smack in the middle of an area that was like that. So I would see it if I would do rotation. I would be in the neighborhoods that would need this type of help, or that would have help inequities. Then also, so once I graduated and I was able to be on the board, I would see it even more. You would be able to see firsthand some of those things. But I think really working for the not working for, but being on the board for the clinic and the mission and things that they do within that clinic really taught me a lot about being able to help in different ways that people need help, whether it's not only financial, sometimes it's just being able to have someone, a physician or a healthcare provider or a pharmacist or nurse that they can actually relate to. So I think that as far as me and doing advocacy work and being in health, making sure that people are able to know about health inequities, I think the biggest thing was just once I sat on that board and I saw some of the patients, and a lot of times on these boards, you have to have someone within the community that is actually being served at these clinics on the board. So even hearing their voice and hearing what they had to say. So I think it's really important the way that we can help as healthcare providers, make sure that you have cultural competency, make sure that you understand your patients. If you work in a community, if it's a community that does not look like you, try and learn their culture, try and learn some of their language, try and learn the things that they like to eat and how it could affect their medication, or try and learn what's going on with them, what's going on in the neighborhood. Do they have a safe place to play? You tell them to exercise and walk, but is it safe to walk in their neighborhood? So do things like that. Like, for instance, do they need a sidewalk? Start a petition to get a sidewalk for them. If you're telling them to go to walk and it's dangerous for them to walk in their neighborhood, they can't even walk because it's a busy street. So things like that, people think that it has to be something that is huge. It can be something as small as that. Just trying to make sure that you understand your community and understand the people that you're serving, that you're not just there working and not getting to know the community. You can't know everyone, but at least trying to understand the culture, understand the people. One goal that I do have is to start a nonprofit that will focus on health, decreasing healthcare disparities and health inequities as well. And I think one of the main ways to do that would be to pair up kids in the neighborhood with physicians, pharmacists, nurses, and have them shadow them, because a lot of times we're thinking that the kids are learning from us. Maybe one day they want to be a pharmacist, but it's really not about that. It's about us learning from them as well, because the more you have a relationship with someone that is different, or someone that you serve in your community, I think it helps you better understand where they're coming from, why they do some of the things they do, what can you do to help. And I think that really having that shadowing experience will be helpful for both the physician, the doctor, the nurse, and also for the young person as well.
That's awesome. Sounds like you have thought a lot about this. And
I
those,
have. Let me just take the step to start the nonprofit paperwork.
yes,
That's the thing.
let's do it. I'll hold you accountable.
Thank you.
Second. Yeah, those are some great practical tips. It all starts with us. And I agree with you about, the practitioners really having the lead here. Is there anything else on a practical level that anyone can do to become more aware of this and to, find ways that they could help with a solution?
I think looking at your local organizations that may need help, even if it's seeing somewhere where you can volunteer, whether it's serving there are a lot of either churches or especially if you have a pharmacy school where they need some clinics that will let you be able to volunteer at a clinic. It may be helping some of the pharmacy students or overseeing the pharmacy students in these neighborhoods. Go and see what they need. Maybe doing a brown bag day. I know you remember, us doing those types of things, but just trying to make sure that you're in your community and talking to them and seeing what they need and seeing what skills you have to help. For me, it could be making a flyer for a community day for health screening. And so, even something like that, I think is very helpful. But I think the biggest thing is just making sure that we are talking, that we're trying to get to know the people that we're serving, and then also understanding exactly what their needs are. But I think the biggest thing is if you try and understand and relate, it will help you as a practitioner when you're speaking to them as well.
Yeah, well, you're certainly a huge inspiration. Can you just mention what the wellness advocacy part of your work looks like? I see you
Mhm.
have some general tips about, how to stay wealthy, get enough, I'm sorry, well and get enough sleep. Wealthy is also good.
Uh-huh.
It gives you some peace of mind and
Right.
gets you to afford good quality food for yourself. But
Yep.
overall, who do you serve? Like,
Mhm.
how does this tie in to your mission, and how do you get clients from this, or who are you
Mhm.
teaching and serving?
So I don't try and get, if my clients wouldn't be the actual consumer, it would be the organizations who are teaching the consumer if they want me to come in and teach something to them. So it wouldn't be I'm charging a patient to do a consultation, which I could do that, but it would be for the organizations to say, hey, we need a pharmacist to come in and talk about nutrition or wellness or a certain drug sometimes. But like today, I did a talk for an organization and it was about invisible disabilities. And people may think you're a pharmacist, well, you know about that, but it was about mental health, wellness. It was about being empathetic and being able to relate to people that you work with. So it's really taking, talking about either health disparities. So if I do a mental health talk, I may talk about how it is less likely for a person of color to actually have a therapist, or people who don't have insurance, how can they afford a therapist? And I would try and touch upon that healthcare disparity part there. So that's the wellness part. It's making sure that if you are if you aren't getting enough sleep, what could happen? If you aren't eating right, what can happen? If you're eating too much sugar, what could happen? And that will tie into, for instance, certain if you have high blood pressure, why you shouldn't eat this and that. And then I'll talk about the disparities that goes along with that certain disease state. So that's how I kind of tie it all together. So it's really about teaching the wellness tips that will help be able to prevent healthcare disparities as well.
So is it correct to say that you work with organizations and you actually train the providers to provide better care and wellness services and serve, the underserved communities as well as other communities?
Yeah, so I do have, like for instance, a particular group that wants me to come in and talk about wellness and nutrition because they want their organization to be able to teach the people in that neighborhood. So it could be one of the biggest things I want to do is to be able to teach healthcare professionals the cultural competency part. So let's talk about ways that you can discuss this with your patients, ways that you can relate to this with your patients, things that be on the menu that you're telling them not to eat, that could be different ways that they can make that food. So I think that cultural competency piece is also important. So yeah, it is teaching the organizations or talking to the organization how they can either help the people that they serve, and then also helping their families. Like the one for today was actually, I spoke to an organization, but they would be it would be the employees, but I was telling them how they can be more compassionate with their coworkers and how you treat your coworkers. And then they were asking questions about mental health and about what I eat. How does that affect me? Does it affect my sleep? Does my sleep affect it? So that it got into that conversation as well. So it really taught them also about talking to themselves. But the ultimate goal is to do more of teach the healthcare providers and organizations how you can teach your clients, your patients, to avoid healthcare disparities and avoid disease.
Wow. Well, I love that this is what you're doing. And I love that pharmacists are able to provide this level of counseling and this level
Mhm,
of inspiration and change for communities, and especially
mhm.
working with organizations, you can affect many people.
Mhm.
Is there any other education or training that you got for yourself, or are you just relying on your pharmacy background to help you with all of this education?
Well, I do have, of course, I have my PharmD, but then I also went back to school for my master's in health administration at University of Wyoming. So I actually did that later, maybe 5 years ago or so. So I actually received that as well. And then I did an online class that was about health and wellness coaching. So that was also a wellness certificate online. But what people need to know is if you're a pharmacist, you know a whole lot more than you're giving yourself credit for. So whether it's things that you learn from researching and reading, we learn how to study everything, right? So if you can learn all of these drugs, there's no reason why you can't learn what is an invisible disability and how something that you eat can affect your mental health, things like that. And the first thing I do in my disclaimer is I say, this is not diagnosis. Don't do like me and go to Google and read every symptom and think you have the disease. You need to talk to your doctor or your pharmacist first. So I make sure I let them know that as well. That's one thing I try to tell pharmacists, especially pharmacy students, do not give medical advice or diagnosis. You are sharing wellness tips. You are sharing statistics about healthcare disparities. And I make sure that I credit websites and things and give them other ways they can go and learn more about it as well. So I think a lot of it would come from the master's degree that I received, but mainly the pharmacy degree, I think was a lot of what really helped me be able to do it. And then some of my own things that I've learned about healthcare disparities being on the boards as well.
Yeah, well, I love all those tips and yeah, the recognition for pharmacists as well as the disclaimer that they should be using. And I agree. I think, pharmacists know so much and they're the perfect career or professional to actually integrate holistic and allopathic conventional resources in one person. So
yeah, I think today someone asked me about we were talking about anxiety and depression, and they were saying talking about drugs and not using drugs. I was like, well, it's up, it's up to the individual. I'm not saying don't use drugs, and I don't want people to feel bad because they have to use medication for mental health. There's different things you can do that are holistic that you can do, but then also you need to also recognize and realize when you do need medication as well. So not to feel bad about that. So just because I'm a pharmacist, I don't always push drug, but then I don't want you to feel the shame if you're on it as well.
Yeah, that's a great point as well. So I'd love to use the last couple of minutes for a rapid round, fire round question with you. So number one, what is your number one tip to improve someone's quality of life right now?
Okay, I think the biggest thing, I really have two. One, I would say sleep, which I could get more of. I think a lot of people underestimate how much sleep can help with your mood, with your cognitive, if you're trying to remember something, even with your weight, people don't realize how much sleep affects you and how it can help you if you're getting enough sleep. So I think one of my number one tips is make sure that you're getting enough sleep. And then also make sure that you're not eating too much sugar as well, because it's another thing that can affect your brain and cognitive ability and your weight that people don't realize. And they don't realize how much sugar are in things that they're eating as well.
Yeah, it's hidden in there. And it causes inflammation, which is the root of a lot of diseases. So I have to agree with you there. Okay, number two is how do you find the time to do all of this? Like have a family, you're a wife and a mom, to do the volunteer work, to do the advocacy work, building your platform, and do the full-time job.
That sounds like a lot. Gosh.
What's your secret?
Well, I think it is, first of all, I have an understanding family and they're very helpful, but I make sure if there's something that I have to do with them, they will come first. Like I told you, I have kids that are very active and play sports and different things. So I have to make sure I'm doing that. But a lot of times it may be doing something on the weekend, doing something at night when they're asleep, when my kids are asleep. But then also just trying to make sure, like for instance, even if I have to take a PTO day to do something, I have PTO. So a lot of people say, well, I'm going to take PTO to take vacation. I took PTO today to do a presentation and a talk to a company, and it's totally okay to do that. So if you need that time as well, feel free to do that if you do want to keep your job. And always do your disclaimer and your disclosures to your company. So my company knows about, what I like to do and what I'm doing. As long as there's no conflicts, you should be okay. So I think doing that, and then also just trying to make sure that I'm balanced and planning. So if I'm going to do stuff on social media, I try to plan it out or even try and schedule it ahead of time. So when it looks like I'm posting, I may not really be posting. It's just being scheduled, you know. So I think that's helpful too, is to make sure you plan it out, do it in a couple of days, and you really don't have to touch it as much as you think you have to.
All great tips as well. So last question for you is, do you have any regrets or anything that you would do over in your career, you know, from point A to point B that, you know, you wish you would have done more efficiently or anything like that, looking back?
Um, I've had a great career in pharmacy, and I actually have enjoyed each area that I've worked in. To be honest, I've had great jobs. So now I work totally from home, and I do travel sometime with my job. So I've been working from home for a long time, and with my managed care job, remember I worked 3 or 4 days in the office. Um, so I would say that maybe the biggest thing would be to maybe during that time, I was actually thinking about this today. During that time where I was downsized for 6 months, I was really comfortable because, to be honest, I still was getting paid, but I wish that I would have done more and ramped up more advocacy work there, ramping up my business more there. I wish I would have done a lot more at that time. I felt like I guess I kind of did push it off and I did a lot then, but I think I could have done a whole lot further. And by doing that, it probably would have been better for me to be able to delegate some of the things. I think during that time, I was trying to do a lot myself, and I have to realize it would probably get done faster if I'm able to even hire someone to do a particular thing that I know that takes me a long time to do. And that will help me go farther in how I'm reaching people as well.
Yeah, that's something I think you just learn with experience, that outsourcing certain things, you know,
Hmm.
it's
Hmm.
just not worth your time at a certain
Yep.
point. You'd rather just spend the money. So thank you
Yep.
so much for this interview. It's been amazing. I learned a lot. I would love for you to share anywhere that our listeners can get in touch with you and learn more about your work.
And you can find me on all social media platforms at Dr. Stephanie Yomo. That's Dr. Stephanie Yomo, Yomo. And you can also go to my website at Dr. Stephanie Yomo, the same spelling.com. You can feel free to email me as well at hello@drstephanieyomo.com.
Awesome. Well, I'll have all that info on the show notes, and I look forward to connecting with you soon.
Thank you.
Take care. Bye.
Bye-bye.